When parents face a medical decision, it can feel like everything depends on one word, choice. But real choice isn't about guessing what feels right. It's about working with your doctor to find the option that gives your child the best possible outcome given the medical circumstances. Today, we look at how to do that with clarity and confidence. Hi, I'm Dr. George Kampouroglou, pediatric surgeon. Here on Kidsurgery, I help parents understand how doctors think so every decision aims at what matters most, your child's health and safety. In children's care, most choices aren't about convenience, they're about timing, risk and recovery. Sometimes waiting is safest, sometimes early action prevents serious problems. The goal is never simply to feel calm, it's to choose the path that leads to the best medical result with ensuring your child's experience remains as smooth as possible. In children's care, most decisions are about timing, comfort and recovery. But let's be clear, what we discuss today does not apply to medical emergencies or life-threatening situations. When a child's life or vital function is at risk, doctors act immediately. In those moments, speed saves lives and there's no time for shared choice. The 3C approach, clarity, calm and choice, applies to the many other moments in medicine when we do have time to think together, planning a procedure, choosing a test, or deciding when to act. In those cases, our shared goal stays the same: the best possible health outcome for your child, achieved with understanding and confidence. You as a parent don't have to decide alone. Good medicine happens when doctors explain evidence and parents share what fits their child's reality, age, temperament, daily life. Shared decision-making combines science with lived knowledge. That's how we reach the best outcome, not just the most comfortable plan. So I use a structure called OR path to make sure nothing important is missed. O stands for options, what treatments are truly on the table. R stands for risks, what are the benefits and potential harms of each. P for pain plan, how will discomfort and anxiety be managed so recovery isn't delayed. A for aftercare, what follow-up ensures the best healing. T for timeline, when is the right moment for action to protect the long-term result? And H for help signs, what early warnings mean the plan needs to change. Each answer brings the decision closer to the best possible clinical outcome. Consider a child with an inguinal hernia. Watchful waiting because parents are afraid of anesthesia and surgery, or plan a surgical repair soon. When we fill the OR path chart, we see that early repair prevents rare but serious complication, the incarceration. The recovery is quick, pain well controlled, and long-term risk low. In this case, the data favor early action. Clarity in facts, not fear, points to the safest solution for the child and ensures the best outcome. Calm thinking from parents helps doctor work faster and communicate better. When you regulate yourself, you hear details accurately, ask sharper questions, and avoid rushed or delayed action. Calm isn't the goal, it's the condition that lets the right medical decision emerge. Every strong decision balances two things: medical evidence and your child's individual needs. When those meet, outcomes improve and regret disappears. To make it easier, download my free ER Quick Guide for Parents. It includes the OR Path checklist and key questions to ask before any test or surgery. The link is in the description below. Subscribe for weekly videos that help you aim every decision at the best possible result for your child. I'm Dr. George Kampouroglou. Clarity, calm and collaboration. These are how we reach the best outcomes. See you in the next video.